Welcome to the new Arizona Nurses Association podcast, where each quarter we sit down with healthcare leaders to discuss what's happening in the nursing profession and healthcare industry. My name is Donna Cato, and I am the current Chief Executive Officer of the Arizona Nurses Association. AzNA's mission is to support the advancement of the nursing profession, to promote a healthy Arizona, and upkeep its core values of respect, advocacy, diversity, integrity, and collaboration. Today, I am thrilled to introduce Mr. Dan Wade, who is a certified perioperative nurse and president elect of the Grand Canyon Chapter Association of Perioperative Registered Nursing. And we're going to be talking about our current legislative session and the importance of advocacy for nurses, not only for patients, but across the profession as a whole. So, Dan, welcome to the show.
Thank you.
So, Dan, can you tell us a little bit about your journey in nurse advocacy?
Well, I have a little bit of a different type of journey in the sense that I always believed in being a professional nurse, and I always liked teaching. And so I had a new nurse to the operating room, and she invited me to an AORN meeting. She was not a certified perioperative nurse. I was. I had been doing this job for 23 years, and I really wasn't involved in my professional organization. And I have to say that I was a little embarrassed that here my student was involved in the professional organization and I was not. And so that made me start this journey of going to my first meeting of the Grand Canyon chapter of AORN. There was this excited lady, Patricia Coates. Didn't know her, but she was so excited about talking about nurse advocacy. And before I knew it, my heart was just pitter pattering. I knew that I had great interest in nurse advocacy. And she started to explain about nurse advocacy, about how we can make a difference, and what we can do as nurses to help our profession. So she invited me to my first attendance to the Arizona Nurses Association RN Advocacy Day. That was the spring of 2018. I was very excited about going. I didn't know what I was going to get myself into, but I knew that I had great interest of seeing what more I can do in my profession as a professional nurse. I went to it, and during that time also, she was talking to our national ARN about sending me to a Nurse in Washington internship in Washington, D.C. My first experience of nurse advocacy was the Arizona Nurse Association. There was an education day, and then we went to the Capitol. And in going to the Capitol, I was very nervous. I didn't know exactly what I was getting myself into. How do I speak to a legislator? And I didn't feel assured or confident in myself and in how to support nurse advocacy.
Well, that is just awesome. I mean, it really just takes one little outreach, like an olive branch, to get you involved and engaged. It's so important. And it's so good to hear that your professional colleagues supported you in your journey. That is just phenomenal. So, you talked a little bit about that you were a nurse for, over 20 years and had not really been involved in your professional association, meaning the one that's directly related to your clinical practice. But then you also spoke a little bit about AzNA, or the Arizona Nurses Association, that really is about your professional practice. And that's why we really engage in the advocacy at the state level. So nurses are very, very familiar with advocacy for their patients, right? Like you were talking about that bedside care and advocating for safe and quality patient care delivery. What are the differences between the advocacy at the patient level, which we are all so familiar with and do so frequently, and advocacy at the professional level?
I believe that there are more similarities than there is differences. The similarities to me is that patient advocacy is an immediate response. It's immediate. You are watching for your patient's best interest. You are their voice. You are making sure that their care is to the highest of standards. When it comes to professional advocacy, I think that it's more of a long-term approach. It's something that once something has changed that you were part of, it's something that has more of a legacy effect. It's something that you know, even though your name may not be on anything, you know that you've had an effect of influencing either the lives of patients or our profession or our workforce. And I think that's the biggest difference is that when you're being an advocate for a patient, it's an immediate response to our patient's needs. Professional advocacy is long term. It's about making a difference in patients' lives and our workforce to assure that everyone is being treated with the highest possible care that they could receive.
That is awesome. I heard you say loud and clear, it's that voice, right? And having that voice at the bedside is so meaningful. It's that internal gratification that we feel if we can make a difference in the patients or the populations that we serve. And then being able to scale that to a professional level, it's still having that voice, right? It's still speaking to those people that are stakeholders within the profession, our legislators, our lawmakers, and being able to weigh in and help them to understand what we do each and every day, the value of nursing, and to support the profession as a whole. So I think that is so critical. So, do you believe that nurses have a moral and ethical responsibility to advocate for the profession?
I absolutely do. Absolutely do. And I have to say that it was an experience I had at the Arizona Nurses Association RN Advocacy Day. There was a speaker, Colleen Hallberg, that had a session in which she made this very very simple comment. And when I received that comment, it was like the light turned on and it was like, yes, this is the reason I am doing this. And she said that nurse advocacy is simply a part of being a professional nurse. And that resonated with me so deeply because that's the reason I'm doing this. I think that as nurses, doing nurse advocacy is something that has an effect on our patients, has an effect on nurses, our workforce, and and being a professional nurse, you should always be striving to improve your education. You should always be striving to improve the profession. And I think that this is something that professional nurses should always strive for, and it's just part of being a professional nurse.
Yeah, I love how you say, it can be very simple, right? So we really do try to take this really complex idea of advocacy and find reasons or rationale of why we can't be involved, why we don't have a voice. That, we may not have, the number of years or the number of experiences, but it really is making it very simple and just putting yourself out there so that your voice is heard in some venue, right? Or some space. Can you imagine? We have over 100,000 nurses in the state of Arizona. If every one of those nurses were engaged in advocacy, the difference that we could make within and amongst our profession would just be phenomenal. But I do want to highlight that, you are naming some key players within this space, Colleen Halberg and Patricia Coates and individuals that help support you. And that is really what AzNA does, right? We have this professional membership or any association that helps to support nurses in their role and in their advancement within their professional role and responsibilities. So, given that, on the heels of our legislative session, as we're winding down this past legislative session, you recently had a major bill go through that was signed by the governor into law last week, Governor Ducey, the OR smoke bill. Can you provide us a little bit of background and relevance to this bill?
So I think the biggest thing about getting legislation passed is that you just have to be patient. It doesn't happen overnight. When I started on this journey for passage of the smoke evacuation bill, this started back in 2018. And I was participating in our National Association of Perioperative Nurses National Legislative Forum, in which we have a monthly call in which we discuss legislative issues. And the biggest legislative issue that we have right now is the harmful effects of surgical smoke that we're breathing as a hazard to our daily life in the operating room. For 23 years of my working life, I had no idea the hazards of surgical smoke. And the best way that I can explain it is that whenever you go to McDonald's or Kentucky Fried Chicken or Burger King, each restaurant has their own particular smell, and you know what that smell is. In the operating room, we have that same thing, and it's burnt flesh. And it's something that I just thought we just had to live with. It's just that's I never even thought that it was dangerous. I had no earthly idea. But thank goodness, because I am involved in my professional organization, though I just became involved in my professional organization, and going to our expo, which is a educational trade show, I became aware that that smoke contains 150 chemicals, some that are carcinogenic, such as acetaldehyde and butadiene, and some potential carcinogenic chemicals, such as benzene and even formaldehyde. And if it wasn't for my mentor, Patricia Coates, and her being up there speaking so excitedly about the subject, I I would not have been on this journey, and I'm very proud to have been on this journey. So, going to R&R Advocacy in 2018, I met Dr. Amish Shah, my District 24 House of Representative, and we had three bills to discuss. And I thought that that's all we were going to discuss is the three bills. So we discussed the three bills, and Dr. Shah was very agreeable to the bills that we had, but he took it one step further. He turned to us in our District 24 group and said, "So, what got you interested in nurse advocacy?" And I thought to myself, wow, this is my moment. Okay, here we go. And so I explained surgical smoke to him. And as luck would have it, here he is. He's an ER physician. And I explained that it's the plume that comes from burning flesh, and he he discussed that he used a Yankar suction, a suction right near the field when he was a medical student to be able to extract that smoke. And at that moment, I said to him, I said, "You know what, Dr. Shaw, that would be awesome if we would have a medical student in every surgery throughout the state of Arizona, and their only function is to take that surgical smoke away from the field." And that was my first little hint to him, this is a concern. This is a concern. Well, COVID happened and all of that. And as luck would have it, Dr. Bliss, which is a former president of the Arizona Nurses Association, and Robin Schaefer, a former executive director of the Arizona Nurses Association, was kind enough this last fall to attend our fall conference for the Grand Canyon chapter of the Arizona Association of Perioperative Nurses. And their session was on nurse advocacy. Well, after the session, both Dr. Bliss and also Robin Schaefer asked to speak to Patricia and I about, well, what's going on with smoke evacuation. And we started to talk to her like, well, COVID, and we need to get back in there and see about making the ask. We're hoping Dr. Shaw, with his medical knowledge, could be a perfect person to understand and submit the bill. And as luck would have it, he needed to have a meet and greet, and I volunteered my house to have the meet and greet, and history was made. He came over to our house. We had a meet and greet, and then someone from the Arizona Nurse Association popped the question, "Hey, what about this problem with surgical smoke?" And then Patricia and I, that was our moment, and we started explaining surgical smoke and the hazards of it and all of that. And it was very interesting that this is a group of nurses. Some were actually CRNAs. And after discussing the hazardous surgical smoke, I even had a CRNA come to me with her eyes wide open saying, "I had no idea all of that was in there. Oh my goodness." So we have a lot of healthcare professionals that you just think, well, that's just part of the job and that's just the smell of surgery, not realizing the dangers of it. And but I have to give Dr. Shaw credit also because he's a logical legislator. He asked us, well, is there any way that this could get accomplished without legislation? And our response and our understanding of it is that, well, yes, you can get the large hospital associations and the small hospital associations to agree to the smoke evacuation, but that doesn't mean that the surgeon in the room will actually comply. And also some of our surgery centers may not comply. So therefore, not all patients and not all healthcare professionals are going to be protected just by having large and small hospital associations agree to the change. And that's when the light bulb, I think, went off with Dr. Shaw. That was on December the 3rd. And on March 24th, Dr. Ducey signed the bill into legislation, and it was incredible. Every day I was checking emails, checking to see where things were. I never thought in my life that I would be the voice of testimony for both the House of Representatives and also the Senate healthcare committees. But basically, what they needed is they just needed someone to educate what the problem was. And this bill went through our state very, very fast. And I have to give kudos to the Arizona Nurses Association's support of us, because if it wasn't for us being affiliate members of the Arizona Nurses Association, I feel strongly that we would not have had the success. And I give due credit to the Arizona Nurse Association, Kathy Busby, our lobbyists for Arizona Nurse Association, and the support that they gave to us, and actually the financial support with us being an associate membership of the Arizona Nurse Association. They also supported paying for Kathy Busby to be the lobbyist for this. And if it was just myself or the Association of Perioperative Nurses trying to come into Arizona to have influence on a bill like this, it would not have had the same effect, because Kathy Busby has the relationships with these legislators. And I feel strongly that if it wasn't for the relationships that Kathy Busby had with these legislators, and Dr. Shaw fighting behind the scenes and explaining what we're talking about, and showing the evidence, the statistical evidence. In fact, one study showed that of 75, and this was a study from the Journal of American Association, showed that 75,011 nurses with a high N factor, that if you have 15 or more years of experience in the operating room, that you have a 69% greater chance of COPD later in life. Wow. And so I am very happy to be involved in this process, but know that it's not just me. It's Patricia Coates, it's Pat Muse, it's Tom Kraus, it's Selena Bliss, it's Robin Schaefer, it's Donna here. It's everyone with the Arizona Nurse Association that has helped support us in getting this bill passed, and is going to protect all healthcare workers in the operating room. And so, yes, you have the Arizona Nurses Association, but the Arizona Nurses Association is actually helping surgeons and anesthesiologists and scrub techs and perfusionists and neuromonitoring techs and x-ray techs. It's all these different professions that actually nursing has once again been protectors of patients and our workforce.
Oh, well said, Dan. Well said. I love how you bring in the fact that to educate. And sometimes we misconstrue that advocacy and education are two separate and distinct activities, but they're really one and the same, right? Is first we had to educate our lawmakers and our or those decision makers on what was the problem and why is it so significant. And sometimes, again, you clearly articulated that it could start with a very small impromptu conversation and then being really strategic in those conversations and getting the right people at the table to have the right conversation and the right information. I just give you I give you a lot of kudos for your work. You really stepped up and stepped out. You took on this kind of stretch assignment from your comfort zone of being that perioperative nurse and really expanded your sphere of influence at a statewide level. And you have to be feeling very, very good right now with the work that you've done and the impact, like you said, that you will have on our professional colleagues and our patients in the future. So I congratulate you on the work. And I did hear from Patricia Muse that this was one of the fastest bills that has gone through in all of our states, because a lot of states are trying to get this bill passed. And Arizona was one of the states that have done it in the quickest manner. So again, kudos to you and your role in advocacy and your leadership in this space. Thank you for all that you do, and thank you for being a part of the Arizona Nurses Association and a part of our great profession across the state of Arizona. And with that, if you have any questions, please feel free to email me. I am Donna, DAWNA, at aznurse.org, or you can go to info@aznurse.org for any questions that you may have and give us some information on future podcasts that you would like to hear about or have us speak about. We are thrilled to bring this podcast to you, and we hope to bring one about every quarter. We will see how this goes, and we're launching it with Dan Wade here. And so thank you all, and thank you for your attendance. Bye bye.